everyone. Welcome to Elevate, your local resource for connecting with wellness experts and businesses along the Grand Strand. I'm Rachel, health and life coach, and this is my friend and co-host, Nicole Huckabee. Hi, Nikki.
Hi, Rachel. As a former news anchor on the Grand Strand, I'm beyond excited to be on this journey with you. So if you're curious about our local resources for holistic wellness living, Elevate Podcast is your go-to resource.
On this episode of Elevate.
Look, this isn't about me. This is about your health, and we need to work together to get you healthier.
Robert Corcetti, or as his patients and friends lovingly call him, Dr. Bob, has nearly 5 decades of experience as a doctor of chiropractic. Dr. Corcetti has dedicated his life to helping people feel better, move better, and live healthier lives. A 1975 graduate of Palmer College of Chiropractic, Dr. Bob has always been passionate about getting to the root of what causes disease and dysfunction in the body. He's certified in natural functional medicine and uses the latest technology and blood analysis to uncover hidden nutritional deficiencies that often lead to chronic health issues. Over the years, he's earned multiple certifications, including chiropractic orthopedics, chiropractic rehabilitation, and he's a diplomate in the Gonstead spinal technique, one of the most respected and precise chiropractic methods out there. He launched his career in Pennsylvania, became licensed in 1976, and worked as an associate doctor at Scott Medical in Pittsburgh. In 2022, he brought his extensive experience to South Carolina, continuing his mission to help people heal naturally and fully. When he's not working with patients, Dr. Corcetti is also giving back by mentoring the next generation of chiropractors as an extension faculty member for Palmer College's preceptor program. His approach is caring, informed, and rooted in decades of wisdom.
Dr. Corcetti, it seems as though you have found the fountain of youth.
I found the fountain of youth.
You have found the fountain of youth. You live this healthy, vibrant lifestyle, and our listeners must go to our YouTube so they can see you as well. But I think it's a testament to the approach, your wellness approach, the way that not only you live, but the supplements and the way that you eat and the exercise. Would you agree?
I think it's a combination of everything. I had a couple things that impacted me probably in my lifestyle more than anything else. And you have to realize, if you saw my resume, my background is accidents, injuries, falls, and traumas. And I've done that for a long time. So I was the director of postgraduate education in Logan, which was doing postgraduate in Pennsylvania. So I got all those postgraduate, I just collected them all the time. But then what happened was I got married. I had 2 children, two little boys, and my wife got diagnosed with cancer. I mean, it was a shock, and that's something that people deal with on an everyday basis, and it's very sad. But I was very young, and so was my wife. So we went and what I did was I networked to all the doctors that I dealt with in Pittsburgh of how to get the best care for her. I dealt with an allopathic doctor, and he was absolutely amazing. He kind of guided me of what to do. But to make a long story short, when we went to the oncologist, he walked in the room and said, "Bob," he said, "here's the deal." And I went, "Okay." He said, "Your wife's got 49 of 50 lymph nodes positive in the axillary area of the arm. And she's got 3 weeks to 3 months to live." And I went, "Whoa." And you need to get your will ready. You need to do chemo. You need to do radiation, and you need to get started. Here's the script. See you, bye. And you talk about a gut punch. And the thing was, I knew these doctors because it was one of the brothers that I was dealing with. And it's not that he was, it's just his field. He deals with this stuff every day, and it's not a good outcome. So I went home, and it was quite a shock to her. So I called a friend of mine, and he's an allopathic doctor. And I said, "Ralph," I told him what happened, and he said, "I'll call you back in about 10 minutes. So he calls me back in about 10 minutes, and he says, "You have an appointment in New York with one of the doctors that I know up there." Matter of fact, he said, "I know him very well. He did some postgraduate work." He said, "You need to go see him." I said, okay. So here I am. I paid $1,200 for flight tickets for individuals to fly from Pittsburgh to New York, and it was last minute. He was leaving for Europe on Sunday, and he took us on a Saturday. So we walk into the office, and he looked at all the reports and everything, and he said, okay. And I said, what do you mean? And he says, Bob, I deal with this every day. I said, Nick, do you realize that she has breast cancer? And he's going like, so? And that's basically what he said to me. Now, did I believe it? No way. And he said, here's what you need to do. And he took me in a room. And in the room was probably as bigger, double what I have here, was all standard process products. And that was the first time I actually was introduced to standard process at the time. And he said, these are the products, are whole food products. And he said, I think you need to do this. But he said, I want you to go talk with a young lady that was out in the waiting room. And I won't get into that whole story. But anyway, she was an elderly lady who flew from Texas to New York 2 times a year. And what she told me blew my mind. And she goes like, Dr. Bob, you need to listen to the doc because he knows what he's doing. And I mean, I couldn't deny him because she had x-rays. And I went, you're kidding. And she goes, he's a good guy. I said, okay. So we walked in, he set up the program, he gave us a script, and away we went. And we came home. And his first recommendations was no sugar. He gave me literature, and it's not that I didn't know it, I did. He said, but Bob, sugar feeds cancer. You cannot do sugar. So the hard part was talking to my kids. So they were small at the time. So I said to Diane, I said, how are we going to do this? She said, well, we need to tell the boys. And I said, you're right. I said, we just need to be transparent with them. So keep in mind, she only was given 3 weeks to live, or 3 months. And I was not going to go the traditional medicine route. I just wasn't. So she and I made an agreement, and the agreement was we were going to go to the natural route. Long story short, we got connected up with the doctor, and he was absolutely amazing. He taught me so much. I can honestly tell you it was absolutely amazing. And I give a lot of credit to Diane. She's kind of my hero because she took this on. You figure, my boys were very small, very young, and she knew she had a very limited time frame to be with them. So how did I know I was going to keep her alive for 7 extra years? I didn't. But I'll tell you what,
Wow.
we cleaned our diet up in a big way. I mean, no sugars, no pops, no preservatives. We ate natural. And the funny part about it was, in 18 months, she was cancer-free.
Wow.
And that blew my mind. I mean, why I'm saying it to you, I knew the radiologist at the time, and he said, he took me in, and I was expecting the worst. And he took me in and he said, Bob, he said, I want to show you something. He said, look at this x-ray. And he said, and he's showing me what was on the x-ray. And I said, okay. He said, look at this x-ray. And he showed me the same x-ray of what my wife had. And it was her x-ray. I did not have any idea. And it was totally normal. And I lost it. I mean, I had so much emotion. And I said, you got to be kidding me. He said, no. He said, this is how powerful nutrition is at this point in time. And he said, you need to do this. And I did. And I switched over from orthopedics, and I did a great deal of it, to nutrition. And I started my journey on learning about nutrition. But what I learned was herbal medicines were like the upcoming thing. Now, that was back in the day. That was in the mid-90s. She died in 97. But he taught me about what herbal medicines were doing, and they were just kind of getting started, what standard process was all about, because they were a whole foods company that was dealing in no preservatives, no pesticides, nothing, and all organically put together. And they were whole foods, which if you look at whole foods, what it does to the system, it energizes the system. But you have to change your diet, period. There's no other way around it. And it was amazing what happened. So I kept her basically alive for 7 years.
So, Dr. Bob, it was your wife's illness that actually led you to change your practice. You went from being a chiropractor to a natural functional medicine doctor. Is that correct? It was that experience. Do you think you would have made the transition otherwise?
No, I was on a board. I was to be the president of a board that we have in our state society. And I just said, you know what? I've got to make a decision here. I don't really care about the board. I care about my wife and my kids. So I talked to the president and I said, look, I know I'm going to get nominated. Can you take this over? And he did, and it was a very easy transition for me So I stayed home, and I needed to make the commitment to her so that we could do this as a couple. You know, I can imagine from her standpoint, she just felt totally ripped. I mean, she was disheartened because she had a limited amount of time with the boys. And I thought, you know, I have to have a commitment to her. And we did. And that was the hardest thing to do, because it's easy to go out and have a drink. It's easy to go out and go to lunch. It's easy to go out and, you know, wherever you want to go. And to change your entire lifestyle for something like that, it was quite amazing. But what happened was, when I went back to New York, that guy, I owe about of indebtedness to him, because he told me what natural functional medicine was about. I then later became certified in that. But that's when my journey changed, because I went from orthopedics and traumas and accidents, and I was very good at that, and I changed totally over into nutrition. And it was a shock, to be truthful. The first seminar that I took, the guy's name is Dr. Dobbins, older gentleman, and he looked like Grandfather Time. And he's speaking way above my head. So I went up to him and I said, Mike, I'm sorry, this isn't for me. And he looked at me and he went, Bob, you're going to be fine. And I'm going like, no. I said, I don't know any of this stuff. He said, you'll do fine. Come back the next day, because it was a 2-day seminar. I said, okay. So I went back the next day, and boy, he put a bow and everything. He tied it. And I walked up to the end of the class and he said, you're going to do fine. And that's where I got started, actually. He was the one that really convinced me of what to do.
I think something that's so important to recognize is that you are an incredible support system for your wife. For anybody that on any spectrum of their health right now, whether they have a chronic illness or they're trying to change their nutritional habits, it really does take a team and a supportive family, spouse. And without that, it's easier to fall backwards, off the track a little bit.
I would say this, it's very traumatic on both parents. It's harder on the wife, obviously, because she's so intuitively connected to the kids, you know, but as I said, it's going to be a limited amount of time. So I guess as a husband, you have to make a commitment. And I'll tell you this, I've had 3 dynamic women in my life. My mom was the first, and she always told me, do the right thing. And that stuck with me even to today, which is one of the hardest things to do in our society, is do the right thing. My superhero is my wife, Diane, because I give her so much credit, because she knew she was going to die. And emotionally, I went through a roller coaster like you can't believe. But that made me stronger in my faith, because I was asking questions, why God? And who knows what that answer is, but it was his choice that she wasn't going to be here. And my other superhero is my wife, Kathy, because she pulled me out of she took my kids, and they were very upset. And she's had 3 kids of her own, and she basically took my kids and took them underneath her wing and helped them get through the toughest part of their life. And I'll share a story with you, and you'll relate to what I mean. So this is, Diane had passed, and Kathy and I got together, and we're at home. So this is out of the mouth of babes, right? It's my little one. So we're sitting around the table, and it's such an emotional roller coaster for her and for me. There's no mom. And so my little one goes, Kathy, are you going to be my new mom? And it was like, my God, we just all lost it. And she said, Nicholas, I can't replace your mom. And it was so endearing at that time. It was probably the single most important thing that my kids could have ever had, because she could never replace Diane, but she really helped them understand what motherhood was all about, and nurturing children and being so supportive and everything. And I have the great fortune, not only is she my patient, but I married her. So it was kind of like God's way of saying, okay, I'm going to help you out here, and I'm going to bring her into your office. Yeah, that's what happened.
You know, Dr. Bob, as I'm listening to you share your story, your personal testimony of what you've been through and how you've had witnessed what changing your life in the way that you feed it physically, spiritually, and emotionally can be life-saving, can be life-changing. For those that are listening that may not have the support that you have had in other ways, you in a lot of ways as
a functional medicine doctor are that support system for them, so that when they come in, they're receiving from you the life-changing medicine. And it is through the foods that you eat, through the guidance that you give emotionally and mentally, and through the nutritional products that you recommend. Talk about that, what that means to the patients, to your clients, how they look to you for their support, because that's so important, that relationship between them and the doctor.
That was mostly done through a postgraduate course. I took a course of a doctor, was out of Florida, and I never met him before, but I needed 8 hours of postgraduate credits. And he was so dynamic. He was actually in a position where he was not healthy. He was going to die. He totally changed it around. And he is just, I call him a super intelligent individual. But anyway, he turned his health around and he learned about nutrition. He was teaching this course about blood chemistry. And LabCorp teamed up with him, and he took the doctors in LabCorp and he wrote the script literally about how to interpret blood work, a comprehensive blood panel, put nutritional therapeutics to it where deficiencies are, and handle that. And it was the most interesting course that I've ever taken. And I met him after the seminar, and I said to him, could you introduce me to the lab? And he said, I'll call him up for you. He said, I'll call him up the next day. So he got on the phone, he called up, and I talked with Barb, the director up there, and she said, Dr. Corcetti, I'll be more than happy to set you up. And she did. I ran my first panel. When I got that first panel back, I knew exactly because I took his books, I took the data, I cross-reference everything, and I do that to make sure that what I'm recommending to you is important. You have to realize something. How does disease get started? Do you know?
I'm going to let you handle that answer.
Yes.
Come on.
I'm sure it's by putting something harmful into our bodies and
That's
toxins and things like that.
That's correct. Well, that is actually the first one. But number 2 is nutritional deficiencies. So I'll give you an example. As women get older, what do they get depleted in? Calcium, right? And they get osteoporosis. Mm-hmm. Or they get osteopenia, then they get osteoporosis. But if you look at that, those are deficiencies. That's a quote disease that's a result of deficiencies of numbers of things. So calcium is one, right? Vitamin D is another one. Proteins are another one. Hydration is another one. So if you took all those entities together, so to speak, and you did the correct thing and you exercise, you can literally take and reverse that. But it takes time. Do we do that as society? No, we don't. Can we overlook it? So when patients come in the office, I do not see a patient unless I do a comprehensive blood test. When I order the test, I order what they call a functional health report. The functional health report tells me exactly what's going on. More importantly, and this is where my background in trauma became, because I was always told, and it is true today, everybody goes through some form of trauma. Physically, emotionally, whatever that would be, right? So you have to go back and find out what their case history is. And that's what I do very well. I go back and look at that and I say to myself, oh, tell me about this. Tell me about this incident. And people will glean over it, not even like to pay attention to it. But the problem is, that's where the problem started. So if you can go back to the source and then start putting things together like a puzzle, and you show them the blood test because it doesn't lie. If your homocysteine levels are through the roof, that's inflammation. How can a doctor say there's no inflammation there? So you give them data. And I think what happens is people are very apprehensive when they come here, but I give them the truth. I give them data. I give them the report. And I would say to them, give me 4, 6, or 8 weeks, and I'll prove to you what I do. But here's what I do. I said to them, and this is the hard part about the patient. So, can you be compliant?
It's hard.
And And if they can't tell me yes, then we got a problem.
What do you see as the biggest obstacle for patients, for people with being compliant?
Chronic conditions. Their lack of information. I'm completely lack of data about how to take care of themselves. And the problem is they think it's going to change overnight, and it does not. So I don't give them expectations of what is going to happen. I try to say to them, look, if you're compliant and you can get through this first hurdle, you're going to see that it's going to be better. And we're going to prove to you that. What we're going to do is in 2-3 months, we're going to do a comparative blood test. and we're going to show you how much improvement that you make. We're going to show you where you go. Well, patients base that off of symptoms, don't they?
Mm-hmm.
It's not about the symptoms. It's about the function or the malfunction that's occurring. And when I can talk to them about malfunction, then it brings in a whole different paradigm.
It feels to me that you actually had to do a lot of education along with the medicine aspect or the healing aspect of it. And people are slow to want to make changes. We do want quick fixes in our society. How do you convince them that they need to buy into what you're telling them to get them to be compliant?
I get in agreement with them first off. First thing I do is I'll say to them, okay, do you understand? And I ask leading questions, so when they're saying to me, okay, yeah, I do know, and they're shaking their head, I know they're pretty comfortable. So once I cross that barrier and I know there's an understanding there, I say to them, okay, can you make an agreement with me? Okay. And there's a pause. There's always a pause. And they're going to go like, what's that? I said, you're going to be compliant for 4, 6, or 8 weeks.
That's the accountability factor, I believe.
That's correct.
It's nice to have an accountability partner, whether it's exercising, whether it's any other actions that need to be taken to move in a healthier way in your life.
Right. And I've learned that when they're compliant, things are going to change. And it's amazing the calls that I get. I mean, I couldn't say some of the stuff on air. You would be howling at what these people tell you. But if,
I love to laugh.
Yeah, a little one. Can you tell us something?
Okay, I'll tell you one, and everybody says it, so it's not really a big deal. So I had this young lady come in, and she was really sick, and I said to her, what are you doing? So she tells me this whole thing, and I said, look, let's do this program. Did I honestly know? I had an idea, but I said, let's try this. And I said, I need you to drink water. Could you do that? Sure. So she took the products, and basically one of the products was to enhance her liver function. So she's drinking water, doing the liver function, right, and everything. So 5 days go by, she calls me back, Dr. Corcetti, I need to talk with you like right away, okay? I have diarrhea. And I'm going like, you can have diarrhea. No, I'm telling you, I have diarrhea. And I said, so tell me, is it watery? No. Is it formed? Yes. Does it have some mass to it? Yes. That's not diarrhea. Yes, it is. Because I would go to the bathroom once every week. I'm telling you a true story. Once a week. And that was her normal because her doctor said that was normal. And it's fine. It's totally okay. So when she went to the bathroom once a day, it was like Niagara Falls. She was drinking water like it was going out of style. And it's hysterical because your bowel functions are the first thing to change.
Well, we all know the importance of gut health.
Yeah, now you do today, but back then you did not. And that's one of the funnier ones because it's usually older people who have the bowel functions that are really not that well. And when you do tell them that, they don't believe you. But all of a sudden things start to transition. And that's what happens. These people will see little subtleties that are improving in their life, that it's the little things that make the difference, not the big things. So when they come back in, and what I try to do is give them time because things take time, to help decrease the cost. I don't usually see somebody in 4, 6, 8, or 12 weeks because they need to do the program. They can call me, that's fine, and I'll coach them through things, but they need to have the body changed to what their lifestyles are. And once you do that, you'd be surprised what happens to them because now they've got certainty, right? Now they see what's going on. When you get a comparison blood test, it's just a game changer. I mean, it really is.
And just from speaking to you earlier, I think it's so important that you spend that time with the patient, educating them and sharing with them what to expect. It's the little tiny improvements that they're going to see and changes that they're going to see. I think overall, we expect to start a program or start a medication and within 24, 48 hours have some sort of unfortunate side effect usually, but see some improvement. We're very impatient.
Right.
We like immediate gratification. And I can imagine that it is invaluable for them to sit down with someone that takes the time to say, this is what you can expect. Small, tangible steps and improvements rather than...
This is where you guys come into play. Because I didn't have that back when I was in Pittsburgh. So I'll share something because what happens is when I came here, I never, my practice in trauma was all referral. So it was all accidents, injuries, falls, and traumas. And I had a good network of doctors, but my patients referred their friends and relatives. So to make a long story short so I moved from Pittsburgh to Myrtle Beach because one of our family members was sick. So I disseminated all of my chiropractic patients to other chiropractors in the area. And I kept my nutrition patients because I could do virtual visits. So I kept them here. My first patient was a fellow, it was my neighbor. He had diabetes for 40 years, on metformin for 30, and not doing well. A terrible case history genetically, and he thought he was going to die at 60. He came in, he had a good PCP, and I think this is one of the assets. I work with other doctors. I don't pretend to know it all, and I don't. So I kind of share that responsibility and get their data and their input. But anyway, this Dr. Vicky up here at McLeod, she's my PCP. And she said, Bob, I don't have trouble doing what you're doing. She said, that's amazing. She said, I know what standard process is. So we kind of blended together. So this is, long story short, it's either 9 months or a year. He's off of metformin, lost 26 pounds, and he was one of the first videos that I ever did. So he's off of all medication. Well, I take it back, he's on 1 or 2. But compared to what it was before, no metformin, and that was done in 9 months.
So I think the testimony here is incredible that you just talked about. And I know there are 3 things that you bring to the table that you want people to understand. Start with whole foods, your nutritional products, eliminate the sugars, exercise, and proper hydration, which you talked about the other patient, drink water, and all of a sudden she's using the restroom more, which is what your body is supposed to do to eliminate the toxins, to get rid of the inflammation. And those are the 3 things that people really need to know in order to have the success that you're seeing, just like with the gentleman you just mentioned as well.
That's right. And then I was saying about you helping me, so your podcasts are going to get out to patients. I need to, frankly, working with both of you, 2 dynamic young ladies, that I need to get to these doctors that should be communicating with me. Look, this isn't about me. This is about your health, and we need to work together to get you healthier. So it's not about all the meds, and they push a ton of it, but I understand. But one of the doctors made a very interesting point to me, and he said, Bob, I can't take you off of medications. And I said, why? And he said, well, you figure that out. You figure, would a doctor want to take you off medications knowing it's going to hurt you? He can't. Mm-hmm. And he said, so if what you do works, I would be willing to do that, but you have to prove it to me. And that stuck with me because that's why I run comparative blood tests. So you give the doctor ammunition, and if he's a little bit more open-minded, to say to the patient, hey, look, let's reduce this medication, let's cut this back. But if the patient's getting results, especially through a blood test, can't deny it. You're not going to deny it all because that's data.
Well, I think part of the problem in our society is that we have been treating symptoms rather than root causes. And you treat root causes, and people really have to have a change in mindset to get to the root cause, whether it's even the stress and emotional things that we go through in life cause our bodies to behave in certain ways. And that's getting to the root cause. That's where you help the patient.
It makes all the, but you got to, what I tell them, make little changes. That's all you need to do. And I'll tell you, the big one today is anxiety. It's huge, right?
I have it.
They give these patients medication. One of your friends, Rachel, that I'm dealing with, and I said, okay, let's do this. Let's take this particular part of your diet, and we haven't changed anything in the diet, but let's add magnesium, Easy Mag, which crosses the blood-brain barrier, and we're going to do something called kava. And it is an amazing herb. And I have probably 10 women right now that I can tell you that it works. It's just a matter of when it upmodulates into the system, it takes time. So obviously, Nikki, yours body is different than Rachel's, so you've got a lot of that time frame. But if you're willing to do it consistently, why wouldn't you want to take an herb that has no side effects, basically, as opposed to a drug which has tons of side effects? So it's getting them to take that little step, right? Now, I can't take them off of medications, but they can ask their PCP, or normally they do it on their own. But once they get the idea that things start to make a difference or changing their diet, it makes all the difference in the world.
I have such appreciation for how you care for your patients and how they truly become family for you.
They do.
There is such frustration in the community with who to trust.
That's
My
right.
doctor says this, but then I'm also hearing this from over here. And I know that there is the opportunity for a nice blended family and marriage between the two. And it seems as though you've already established that here by communicating with your patient's existing doctors.
Correct.
And creating a trusting relationship with them that says, this is what I would like to do. Is this something that would, benefit them and so forth? I just have such an appreciation for that, because I've been in that place a time or two, very frustrated with, I'm supposed to take these medications, but I also know it's treating the symptoms, and I need to know what I can do with herbs and nutrition for the long term.
That's correct. Very much so. Frustration is probably very high here in the Myrtle Beach area compared to anybody else, because it's kind of a, I don't want to say it's a destination area, but it really is, because people come here for what? To relax and go on vacations or what have you. But it's kind of a senior citizens community, and people, this is a party animal place. It rocks. But to make a long story short is, that's fine. But when it comes to your health, think about this. You're not doing well, and you're given a product or products that are going to help you change. And what you have to do is you have to engage. I get them to engage, but I get them to engage small, not expecting this big transition, and get little things over time, and give time, because time is your asset, not your liability. So if they can do that, they're going to get results. And you can go to my website. You can see patient after patient. And these are all true stories that I've got as patients that will share their stories they're very compelling. And I think that's what happens. That's where you guys come in. Because if we can get this out to the people here, we can make changes in people's lives. We can connect with doctors that, frankly, they want to connect with us. They don't know we're there.
I feel like you give your patients hope. You give them hope. And that's really what we all need, is a little bit of hope, someone to be in our corner. I just got to know, how are we supposed to get off all of these sugars? I think that's a big one. I know that's important. What do you know? The sweet beast, right? Defeat it.
Here's what I do with patients. I give them a 4-week diet sheet, and I ask them, don't change, eliminate, add, or do anything to your diet. 4 weeks, promise. And they do that. So they bring that back in 4 weeks, and I show them their diet. And I would say to them, okay, so you tell me you have protein in your diet. Let's take a look at breakfast. What do they eat for breakfast? A muffin, a cereal, right? So there's no protein in breakfast. Now comes lunch. So we're going to give them not even lunch, but when dinner comes around, they have a protein then. The problem is they snack, right? The cortisol levels go up at night. They can't sleep. They don't understand that concept. So when they took a look at the diet, they're going to go like, holy crap, I see what you're meaning. And that's all you got to do is show it to them, because they don't know what they're eating. It's just that simple. Mm-hmm. And even Dr. Lee says the first thing, food is the single most important thing that you can do, especially if it's organic, right? So it changes the body physiology and chemistry. And that's why Standard Process their sister company, which is MediHerb, they're the leading herbal company in the world. And their doctors, and to answer a question which I didn't answer for you before, I'm on every 2 weeks doing something with postgraduate, learning about the laboratory guys, the people, my people that I talk with on an everyday basis to help patients get better. And what I try to do is give them data and documentation of how that they could look, or the research behind it. So when they get that, they don't have to believe me. I don't want, to be honest with you, I want them to believe me. I want them to read it. I want them to look at it and see it, and then they can't deny it.
Okay, but Dr. Bob, believing is seeing, except for those of us that are of faith, right? So for you, at least you have some labs to show.
Here's the thing, when a woman loses what does a woman like to do? What's the first thing that she's going to tell me?
She probably wants to lose weight and not age.
Exactly. So the first question that I get from a female is, Bob, I want to lose 10 pounds. And I look at them and go, no, we're not doing that. And they get so frustrated enough, because it's not about losing weight. Make sense? So when
Yes,
you,
but that's a mindset too. We've all been in this little box to try to be skinny, and menopause hits, and then it's all out the door. So
that's
I
true.
get it though.
So when you go to my website, there's a couple people on there that will tell you what they did, and it would blow your mind because it's a journey, and you can't expect this to take somebody who's 55, 60 years of age, has gone through menopause, and make these radical changes because they can't. I don't care what you hear on the internet, on Facebook or whatever. It takes time. I always said, and I was taught this way, take a little an elephant one bite at a time. That's all you got to do. And once they make those changes, they'll ask you, what else can I do? They get engaged, and that's what's important because when they get engaged, what happens? You got them, and they're going to get better, and they're going to tell you. They'll tell you some amazing stories.
Culturally, it's very misleading as well because we're constantly told that we can lose weight if we go through certain programs or pills or what have you, or new exercise programs, and it doesn't allow for women and men included to step back, take pause, and really look at the root of what is going on. And I think it's important to share as well that the way that you were when you were younger or a different season in your life is not going to be the way that you show up to your day
That's right.
today and present day for a number of different reasons, and changing our mindset and approach to our health, not to lose just 10 pounds, but maybe lose the anxiety, the frustration.
There you go.
What else do we want to release in order to gain that peace of mind and confidence in the 10 pounds we carry, but maybe in a healthier way?
Yeah, it's hard. It's very difficult because you're like what you're saying. You're connected with a doctor, and you're so frustrated. That's where people come to me, and I'm going to go, okay, we're going to do something different. We're going to look at this thing, but I need time. And that's where that agreement comes into play. And they usually will give you a certain amount of time. And normally in a hormonal situation like a female, what do you do every day? Oh, I'm still 158 pounds. I don't care. Get off of the scale.
Jump on the scale.
Exactly. Well, they get so frustrated, right? And it's the worst thing to do because it's here. It's about your mind. And your mind will play it'll devastate you. And that's what I try to get them out of. So if we can get them out of that mindset, so to speak, or that's false information. It's just false data. So you can get them out of that and focus on the deficiencies or their lifestyle changes, you would be surprised at where it's got to go. So my goal is not to tell you what to do. I try to give you options. And I think as a doctor, that's most important for me to do that because I say to them, look, if that were me, I wouldn't go down that rabbit hole. But I would try this before. The trouble is, it's going to make you commit. So can you do that? And I would say 90% of my 90% of my people, they want to commit because they're not well. And the other 2 to 4 to 5%, it's okay. I'll take 90% anytime.
Dr. Bob, how long have you been faithful to your message, to what you're delivering to your clients? Because you look amazing. And I know your wife is gorgeous as well. And you guys look like you're still in your 30s. And maybe you are. I know you're not. But I'm just saying, how
I'm
you
going to
are.
interview you. How old do you think I am?
Gosh, I don't know.
You looked up on the internet.
Well, Rachel gave me, some intel on some things, but, you look incredible.
Thank
So
you. I appreciate that.
what I'm trying to convey is you're walking the walk yourself. How long have you walked the walk of your practice and what you are trying to help others to do so that you can give them, I think, again, it's going back to giving people hope and just making the small changes. And is it really difficult for you now to do that? I suspect no, but I suspect because you walk the walk, you're able to encourage your patients to do the same. Look at me. Look how great I look is what I would say.
Well, to be honest with you, I've celebrated my 50th year. I've been in practice. I was the youngest chiropractor to graduate college. And I'll just tell you a little story here. I'll post this on Facebook. My roommate was from South Carolina. His dad was the president of South Carolina Chiropractic Association. And he just called me. We just had dinner 50 years later. And he was from South Carolina. I'm from Pennsylvania. We're meeting at Palmer College. And the next thing you know, I'm going down the middle of the hallway and I hear this guy whistling Dixie. And I'm telling you a true story. You can't make this up. And my mom says to me, wouldn't that be funny if that was your roommate? And I went, oh my gosh. So I go to the bathroom and he's in there and I'm in there and he turns around to me and he goes, I'm looking for this guy by the name of Bob Corcetti. Do you know him? And I about lost it right then and there. And I said, yeah, that's me. He said, well, I'm P.R. Johnson and I'm your new roommate. I will tell you a true story. And we were roommates for all of our years in college until he got married.
How about that?
So yes, so been in 50 years since March is when I graduated, and to be truthful with you, I'm very blessed to be here. I love Myrtle Beach. I should have been here 10, 15 years ago, but the people are wonderful. But everybody asks me if I'm going to retire. No, I'm not. I love what I do. I like the patients. I don't have patients. I have family. So I have to be honest with them. Sometimes it's pretty tough, but you develop relationships over time. And that's what I want to do with patients, is develop relationships and be honest with them. And that's not given today, unfortunately. So I try to be a little different.
Well, you are different, and we appreciate that we are now having a friendship and relationship with you so that we can let more people know about the good work that you are doing and how you genuinely want to help others live a healthier, happier life and make the small changes that will make the difference for the rest of their long, lengthy lives, hopefully. And, we could just talk forever with you, Dr. Bob, because you're just a wealth of information, but you'll have to come back and visit with us again, okay?
Absolutely. I'd love to meet you both. I know, Rachel, we've met, and you're quite a dynamic young lady. I am so impressed with what you've done. And you guys are so much on the right path. You are so, I don't think you know how far ahead you are of the schedule. We just need to connect the dots, and I'll help you connect those dots. And you know what? You're going to move the community. I will tell you that.
Well, that is our goal. And as always, I know Rachel has probably a final burning question for you as well.
I do. I have to ask, for our community that is listening, what is, in your experience, you spoke about taking small, actionable steps, Dr. Bob. What is the one thing that people can start doing today that will make a difference in their health? Something that will move the needle forward by just 1 degree forward to help all of us elevate our health and wellness journey.
Something simple that something doesn't cost?
Yes. Something they can implement today.
It's life-changing and it's dramatic. Get rid of sugars. It's that simple. Very, very simple. The doctor, I was telling you, the doctor in New York, it's the first thing he told us. Bob, you got to get rid of all sugars. And I was young in college, obviously, or not college, when I got out of practice. Did I believe that? Honestly, no, I did not. I did not know then what I know now. But he was so spot on. I mean, and that's the single most important thing I would tell you. Get rid of sugars, titrate them slowly down. Don't get rid of them right away. You'll go into too much withdrawal processes, and eat the more natural, more organic. It's just a transition. That's what you need to do. And we all try to do it too fast, too quick, and too much.
Great advice.
Yeah. Yes.
Great advice. Get off the sugar. Well, I have work to do myself then. I don't do a lot of sugar, but I want to eliminate more. So thank you for that.
Thank you for having me on board. I thoroughly enjoyed it.
Thank you so much.
Thank you, Dr. Corcetti. Wait, don't go anywhere. If you are enjoying the Elevate podcast, could you do us 3 favors? Leave us a review, join our newsletter, follow us on social, and wait, it's 4 things, and share the podcast with friends and family.
Absolutely, Rachel. Your reviews help us grow, reach more people, and contribute to our mission of connecting local wellness businesses with individuals seeking their support and services. Please take a moment to leave us a review. To get the most out of your listening experience today, we invite you to join our newsletter. We offer wellness-based resources, recaps, show notes, and links. It's like a culinary garden of wellness resources.
Until next time, have a healthy and blessed day.
We hope you enjoyed today's episode. The information provided in the Elevate podcast and associated materials is for general informational purposes only and is not intended as medical advice. No content should be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Reliance on any information provided by Elevate, its host, guest, or contributors is solely at your own risk. We encourage you to consult with a healthcare professional before making any significant changes to your diet, exercise, or wellness routine. Ultimately, your health and well-being are unique to you, and it's important to make informed decisions based on your individual needs.